demonstrate how to set up antibiotic sensitivity testing using antibiotic discs. We do this when we're in between two organisms and we're identifying unknowns. More than likely, a similar setup is also used when we're trying to determine antibiotic sensitivity in the Kirby-Bauer test. But that's not what we're doing today. The type of antibiotics that we may use when we're in between two organisms are going to be uptouching, Novobiocin, or bacitracin. I'm using Novobiocin today as the example, and as it is a gram-positive cocci, we prefer to grow those on blood agar, which is what I'm going to use for the demonstration. You will also be using sterile cotton tip applicator. We're going to have alcohol, we're going to have forceps so that we can actually do this aseptically. Now, this is a cartridge that has discs inside of it. Those discs are going to be the antibiotic discs that will be removed and applied on top of the bacteria. But first, let's talk about the application of the bacteria. I'm going to open my sterile swab, remove it. As it is a swab, we are not going to be flaming this. We are going to be flaming the mouth of the tube that we're going to be transferring from. We prefer to do this from broth, but we can also do it from solid. That's what we have here today. I'm going to flame the mouth of the tube, and I'm going to grab as much bacteria as I can with the swab. And I'm going to transfer to cover most of the surface of the blood agar. It's kind of fun, it's very artsy. I do it in both directions. I want to make sure that I have bacterial growth all over the surface of the agar. And now this is ready to go. I'm going to dispose of my swab in a pipette box. Swabs that have bacteria like this should not go in the trash. And I'm going to transfer the antibiotic disc aseptically by using the forceps and alcohol. I'm going to dip the forceps in the alcohol. I'm going to flame the forceps. You don't have to hold them to the flame because the alcohol is going to burn off. I'm going to transfer a disc from the dispenser. You actually just have to pull them out, place it on top of the bacterial culture. I like to tap it a little bit, but you don't have to jab it in there. I will dip the forceps in the alcohol one more time, flame them so that they are clean for the next person that uses them. And now this plate is ready for incubation. You can actually flip it for the incubation and it still will be okay, like you would do with any incubation of a plate. Now, after 48 hours, you will have growth on the surface, and we're gonna look for a halo or no halo around the disc. So I have two plates here that have grown 48 hours, and you can see that this plate has a halo around the disc, and this one has a very, very small halo, almost nothing. Now, the appropriate way of determining if it is resistant or sensitive to the antibiotic is by measuring the diameter of the halo. I prefer to mark the halo with a Sharpie from one end to the other. I'm going to use a ruler. We're going to measure in millimeters. And for this specific antibiotic, if it is 16 millimeters or larger, it is actually considered to be resistant to that antibiotic. And from this measurement, I can see that it's at 19 millimeters, so that is resistant. Obviously, this one is not going to be one that is going to be considered resistant because that is certainly less than 16 millimeters. So it will be sensitive.